Hi, and welcome to Beyond the Pelvis. I'm Laura Haraka, a somatic practitioner, breathwork facilitator, and someone who's been on the healing journey myself. I know what it's like to live with chronic symptoms and feel disconnected from your body, and I also know how powerful it can be when we start to listen, slow down, and heal from the inside out. On this podcast, we talk about the mind-body connection, nervous system healing, pelvic health, and all the messy, beautiful layers that come within learning to trust your body again. Whether you're brand new to this work or deep in your process, I'm so glad you're here. So let's dive in. So welcome to another episode of Beyond the Pelvis. Today, I am honored to introduce Jen Romanello, MD, a resident physician in internal medicine in New York City. Jen is co-leader of the Early Career Special Interest Group at the Association for the Treatment of Neuroplastic Symptoms and the founder and president of the Forum on Female Sexual Medicine, an organization that has connected over 1,000 trainees with educational research and mentorship opportunities. Her passion for neuroplasticity and pain science began in medical school when she learned how to overcome her own chronic pain. Since then, her research and publications have focused on chronic pelvic pain, medical gaslighting, and medical education. Jen is also an active member of the International Society for the Study of Women's Sexual Health and the Menopause Society. Jen, welcome to the podcast.
Thank you. I'm so happy to be here today.
I'm so happy to have you here today. And I'm just wondering if we could start off by you sharing a little bit about yourself, who you are today, and what brought you into this space.
Yes, absolutely. And I feel like I'm coming here today wearing multiple hats because we actually met in 2023 when I was having neuroplastic symptoms, and we met for a few sessions as my coach. So this is awesome to be back speaking with you in this context. So yeah, I also now am in residency. Last time we spoke, I was still in medical school, and I'm pursuing internal medicine, and also having neuroplastic symptoms was one of the reasons why I chose internal medicine. That was a later decision in med school. And then I love that I've recently been getting more involved in ATNS with the early career SIG. And then it's a lot of my interests coming together personally and professionally, I feel like, in talking about pelvic pain and neuroplasticity.
I can tell you, I am so thrilled to have you here. We had a couple coaching sessions years ago, and I'm so honored that you're here and so happy to see how well you're doing. And you took a struggle and turned it in to something so marvelous to spread the word about neuroplasticity. So I'm kind of curious if you can go back a little bit. And you had chronic pelvic pain, as you said. And I'm wondering how these symptoms affected your daily life, your relationships, and even as a medical student.
Mm-hmm. Yeah, so when I was in med school, I first developed knee pain, and then it was pelvic pain and back pain, arm pain, other types of pain. It was all over. And it would impact me on so many levels where even just studying was really hard to just sit for an extended amount of time. It was really interesting being a med student, learning about medicine, while also being a patient and learning about neuroplastic symptoms. And that also has really impacted me and like my approach to medicine, where I sometimes felt like I was in a different paradigm than what I was being taught. I can speak for my own story where for, my pelvic pain, I had a pelvic floor physical therapist, and I was getting injections, and I was on muscle relaxants, and then I had knee injections and knee physical therapy and arm physical therapy, and everyone was kind of treating their own symptoms. As opposed to seeing how everything was related, how everything was neuroplastic symptoms. And so learning about neuroplastic symptoms in med school has given me also an approach to really understand the body as a whole and how so much of our health is really more related than we might initially realize.
Right. Now, I'm just curious, has there been a lot of education in medical school about neuroplastic symptoms?
I really have not so much seen it, but when I've spoken about it to people in my training, people have been very open to it and I think are very excited to hear about it, because we know that we see patients in clinic or in the hospital who have symptoms that aren't really described on labs or on imaging, and then it sometimes can feel like, well, what else can we do to help these people? And that can contribute to burnout for practitioners. And so people are very excited, my co-residents, other attending physicians, to hear about it, because then it's like, okay, well then there's something else that I can do. But it's still a paradigm shift. So I've also developed certain ways that I talk about it in my own experience, or with the concept of phantom limb, that is neuroplasticity in the brain, that I think everyone can find relatable.
Yeah, exactly. So you went through a lot of tests, procedures, and saw quite a few doctors, correct?
Absolutely, yeah.
Yeah. So I'm curious, what was the turning point where you went over to the mind-body world? When did that switch flip for you, that you're like, I think this might not be physical, but this might be neuroplastic pain?
Yeah, so I was about 2 years into my symptoms, and I actually had to take a year away from medical school because my symptoms were so severe, even though I'd already tried so many things. And I also did a lot of research that year, so it was very good for me personally and professionally. But I have a family member who's a doctor who had been seeing me on this whole journey and made a comment to me one day that the gist was that my pain was not coming from an issue in my body, that there was something with my mind and nervous system going on. And my paradigm that I was in is that if someone tells you there's something going on with the mind-body connection in your symptoms, that it could be very dismissive. It's like, oh, it's your fault. And so I was very upset. That was the paradigm I was living in. And I was so desperate for answers, quite frankly, I just looked into it and Googled things about that. And then soon after, read one of John Sarno's books. And so I became pretty open to it in a matter of days, because I did see a lot of myself in it. For example, right after learning about this, I went for a short walk and I noticed how my symptoms move around in a way that wouldn't be structural. Like my right hip had some pain, and then a minute later my left hip had some pain, and then it moved to my right leg and then my left leg, and that's just very atypical of structural issues, especially the ones I had been diagnosed with. And then I also would notice when I was really engrossed in an activity, the symptoms would go way down. And I also had bilateral tennis elbow happen on the same day, and that just would be very unusual for structural symptoms.
You know, it's so great that you were open to it and learning about it, and you went and Googled it. So my story's a little different. I had a chiropractor who I was friendly with told me, Laura, I don't think there's anything wrong with you. I think this is due to the stress you have in your life. And I was pissed off. Mm-hmm. I was completely pissed off. How could someone tell me this pain that I was having was not physical? And I begged him to give me an MRI. Mm-hmm. So he ordered the MRI, I did it, and the bad news was they found something. So I was almost like, see, I told you there was something there, but I didn't know it yet, but they were normal abnormalities that were not causing my pain. I was diagnosed with pelvic congestion syndrome, and that MRI led me to actually having a surgery with no help for my symptoms at all. Yeah. So it's really amazing that you were so open to it, and I wish I was. So I went through the whole medical gamut for years. Mm-hmm. Until it was an absolute last resort.
Okay, yeah. I think not only how clinicians need to be educated on this needs to change, but also just the public. Because I have heard many stories of people who hear about this and don't think it's relevant to them. And then it eventually, maybe even years later, they will come around to seeing their symptoms as neuroplastic, and that's when they get better.
Exactly. Even some of my friends, when they tell me about a pain they have, I ask them what's happening in their life. And they say, Laura, my pain is real. Maybe yours wasn't. Mm-hmm. So there just isn't a lot of knowledge out there, but it's getting there. It's, getting more known out there with people.
Yes.
So you mentioned that we worked together. Mm-hmm. So it was just a few times, I remember, maybe 2-3 times. And I'm just curious if you can talk a little bit about our work together, what felt maybe supportive, what felt impactful for you.
Really loved how you would talk about ways to calm the nervous system. And I still think about how you would say fun, laughter, and joy are so important for healing, because that was something I hadn't thought so much about before. And when people have chronic pain, it can really steal those things. So that was a huge takeaway that I'll still think about sometimes. Just important for life and healing in general. I also just really appreciated that I knew your story coming into working with you, and that you had pelvic neuroplastic pain, and that in and of itself was very therapeutic, because I also could see how you had gotten better as well.
Yeah, so the hope, hearing someone else or even working with someone else that had the same symptoms can be actually helpful, even though neuroplastic symptoms can be treated by someone, or pelvic pain can be treated by someone that hasn't had pelvic pain. Sometimes it's nice for them to understand what you've went through.
Yes, I felt like you really could have that understanding on a deeper level.
Yeah, yeah. And so you took everything you've done, your chronic pain, and now you have really branched out. I mean, what you've done is actually amazing. And you're doing work with ATNS and early career interest groups. And I'm kind of curious if you can just talk about that a little bit, because this really sparked like a passion in you.
Yes, absolutely.
This wasn't just like I got better and I'm going to go on with my life. So I'm wondering if you could talk a little bit about that.
So I started this early career SIG with John Clifton, who also graduated from medical school around the time I did. And we are having a general body meeting tonight, and we had our first event in May. That was a lecture. And I really hope with this group that people early in their career, in their 20s and 30s, they could be in health professions, they could be coaches, they could be advocates. In other ways, we can come together and support each other in community. And people also, we want to connect more to mentorship and hear exactly what our members want to get out of. That's what we're going to be talking more about at our meeting tonight, so that we can have this community as we move forward in our career. And it's also very important to get people early in their career involved in ATNS, because I think that's also very important for the longevity of an organization.
Yeah. So you completely turned your pain into purpose.
Yes, definitely. I have a very different relationship with my pain than I used to. And I'm free from chronic pain, but I still might get a twinge here or there. But I don't view it as an enemy. I really view it as it's a sign that I need to check in more with myself about how I'm feeling, and it's helpful. So I, at some points, when I was in that year of medical school, when I was going through all of this, and what now is my life seems almost impossible. And I gained so much from also hearing other people's stories. So I'm very happy to be able to pass it forward today.
Right. So is that part of the reason you do this?
Yes, I think as a physician in my training, I want to be able to practice this in the future. I really have a focus in my mind on healing, not just putting band-aids on symptoms. And that was really why I also chose internal medicine, so I could understand the body as a whole, more long-term relationships with patients, and really see how different aspects of people's lives impact their health and well-being. Because initially when I went to med school, I was thinking, for example, OBGYN, and then I changed to psychiatry at one point, and then I felt like internal medicine would be good for me for a lot of reasons, but also with this interest that I have.
Yeah. So you said that when you get a twinge or something, because we can't stop pain in this world, and we don't actually want to stop pain. Mm-hmm. Pain has a purpose in life. We don't want to have chronic pain. But you said it's a chance for you to check in. Mm-hmm. What does that look like? Can you talk about that a little bit?
I think if I were to have symptoms, so maybe it's a little bit of back pain, for say, okay, well, what is this here to show me? And it often is that maybe I'm taking on more than I actually want to be with extracurriculars, for example, which I do love, or saying yes to some commitment, even socially. It'll make me stop and slow down. And then when I understand that, then it doesn't continue.
Yeah. So it's great. It's looking at it as a way to check in your pain. Mm-hmm.
Yeah. And I'm just curious because we talked about how we met and I emphasized joy and fun. And I know I had Dr. Clark on the podcast, and I believe it was him that talked about one of the most important things to healing from chronic pain is joy, right? And it really is. But I'm just curious if you could share maybe some of the other ways or techniques that were helpful to you along your healing journey.
I think one thing that's really hard, but that was key, was to not be on a timeline, because then that makes pain the enemy. There's an urgency and a pressure. I also very slowly reintroduced activity. That was mainly with my knee pain, and then just also eventually not focusing so much on it. Going initially, it was like, wow, I could go through an hour without thinking about the pain, but that also would be really helpful to do something very joyful and fun in those times too. And then, yeah, gaining more evidence. I wrote down an evidence journal. I learned about journal speak. I did some of that, and then all focused on pain reprocessing therapy and just really understanding that this was relevant to me and like why this was happening. But it was a process. Initially, when I learned about this, I did initially become symptom free in a matter of months, but then there would be reasons why it would come back, and then it took over a year to really be free from chronic symptoms.
Yeah, so it sounds like you used a large array of things to heal. Journaling, pain reprocessing, and I think it's important because we don't want people listening today and then writing down, okay, Jen did this, this, and this. Now, and she got rid of the timeline and she made an evidence journal, and that's the way out, right? So I think it's so important for people to find their own toolbox. And I talk about, I think it's kind of funny, Dora the Explorer. She has her backpack, right? And she knows the tools and the things in her backpack that could help her, throughout her journey. So I'm wondering if you could say a little bit about that. Do you feel like, there's this strict model to get rid of your pain, or how do you approach it when you talk to people?
I think that there are different tools and some will work better for other people, but it takes time. It takes some trial and error. And also, like, trying one thing is not going to immediately change, because that's what neuroplasticity is. It takes time for the changes to occur. But like for me, with my symptoms, if I'm overextending myself, what I will do is really schedule in time for myself, or time to really check in about what commitments I actually want to be doing. So that's a tool that was really specific for me.
Yeah, so everyone has their own specific toolbox. And it's important that people realize that, because they'll hear my story and they'll be like, okay, I got to dance to get better, or I have to do this to get better. And we want people to do what feels right to them. And I love what you said, you got rid of the timeline.
That was really key.
It was, because, I used to say to myself, I just need to be better by Christmas, or I just need to be better by Easter, let's say. And all that did was put more pressure on the healing.
Yes.
And the other thing that I think is really important that you said is, you use anytime you get a twinge to check in now. And what I do is I incorporate balance in my schedule. So I literally schedule break time.
Yes, things like that, for sure. And
because we know our triggers.
Yes. And that's why it has to be personalized. And not everyone has to turn their pain into power the way that I have created a SIG for ATNS. That is just what was right for me. And it took me a while to even be able to speak openly about this with people one-on-one that were close to me. But I also have had this interest in pelvic pain even before I developed any neuroplastic symptoms. And so it's a lot of things coming together that I find very meaningful. I also had gotten a grant from ISWISH, the International Society for the Study of Women's Sexual Health, looking at patients going to doctors to get a pelvic pain diagnosis and their experiences of dismissal or being misunderstood or their pain being normalized. So this was also an interest that I had, and it also gives me a lot of purpose to continue doing this work. And coming from that understanding was also a reason why I was very resistant to the idea of neuroplastic symptoms initially, because I'm like, oh, women are so often gaslit, especially when it's pelvic pain, and there's a lot of things to hold all at once. So like people with pelvic pain can be told it's all in your head, have a glass of wine, just relax, and it's gaslighting. I think it's interesting that doctors in those scenarios are getting at some mind-body component, which can be the case for patients, but it doesn't really address any neuroplastic symptoms. It's not validating, and it also is not looking for other causes too, because it's important that clinicians will also keep a broad idea of what could be going on to consider everything.
Right. The medical gaslighting, I think, is the worst, because I remember one of the doctors looking at me and saying, after I think it was a urodynamic study that I had done, and he looked at me and he said, "There is nothing wrong with you. You need a psychiatrist." Now, the truth was I did need a psychiatrist because I was having such bad anxiety and depression at the time. But I was completely gaslit with the fact that he just basically dismissed me. Mm-hmm. And I know that happens to so many people. And it even happens to men with pelvic pain. Mm-hmm. They say there's nothing wrong with you, go ride your bike, go live your life, and you're fine. But there is a lot of non-understanding of this type of neuroplastic symptoms in this world. And if we could spread the word more to doctors, and they listen to these podcasts and things like that, they know there's more to it. And this pain is real. We're not making it up. It's not in our head. The only thing that we're saying is it's coming from the brain.
Mm-hmm. Yes. And the nuances or the differences in how to communicate that are really important. And yeah, there really is not so much training on that for sure. But it's been interesting being in residency and seeing patients in clinic where if they have a pain, we've done a whole workup, everything is negative, and then how to communicate about neuroplastic symptoms with them.
Exactly. And it's really hard because you just said, if everything's negative, mm-hmm. then we can talk about neuroplasticity. But the problem comes in when you find things. Because with me, every time they did a test, they found something. So it becomes, very tricky as even a doctor to differentiate between, is this neuroplastic, or is this really a structural, cause of this pain that this person is having? Right,
because sometimes even when there is something on imaging, it doesn't mean it's actually causing the
Right. Yeah. So we have to be really open to so many factors. And in December, I went to a doctor because I had a really bad infection on my foot. And she was a very nice lady. She did not dismiss me. She said, you have an infection and you need IV antibiotics for a month. Okay. So I believed her, but I said to her, do you know what I do for a living? And I handed her one of my brochures. And she said, what's this? And I said, well, I'm a mind-body practitioner, and I talk about, pain coming from the brain. And I said, it's so interesting. Not one doctor that I have seen, even though it's a physical symptom or we've seen something on a test, said to me, what's happening in your life?
Yes. Yeah. Very important to keep in mind. And, I think in internal medicine, I have some patients I will see like every 6 weeks or so. And it's easier to ask those questions also when I know someone better. But sometimes I just have to ask it in a way that is, still approachable and patients know that I care.
Exactly. It's true. You have to be very careful how you bring this up to someone, mm-hmm. because you don't want them to think they think it's in my head. Mm-hmm.
Yes.
So it can be very tricky sometimes, and people get very attached to their pain.
For me, it was interesting because I was already a relatively knowledgeable patient when I first had pelvic pain. So within a week or two of developing symptoms, I already had a diagnosis of pelvic floor dysfunction after one doctor, which is very unheard of. And then very quickly was starting in physical therapy, and my symptoms did not get better though with that. And so with even being somewhat of a knowledgeable patient, it was still very hard to maneuver this landscape. Even though I can't imagine what then it's like for patients who do not have a certain medical background.
Right, yeah. Because it can be really scary, having these symptoms. And, people talk to me about pelvic floor PT, and I wanted it to work. I went into it thinking, oh, this is going to be my cure. But for me, it didn't work at all. And I give this example to people that if you turn the water on in the kitchen sink, then the water starts rising and rising and rising, and it eventually goes over on the floor. For me, it was literally like the pelvic floor PT was like literally mopping the water up off the floor, but I needed to shut the faucet off.
Yes, I really
And yeah. And it's not that they weren't helping. They were making those maybe muscles looser, but until I was going to shut the water off from my brain, it wasn't going to help. I'm not saying pelvic PT isn't a good modality. It's not to say that at all. There's some really good pelvic floor PTs out there, but there has to be an understanding of bringing both worlds together, I believe.
Yes, I definitely think there can be a role for pelvic floor PT in neuroplastic pelvic pain, especially in how it reinforces messages of safety for the nervous system. But the physical therapy that I did would reinforce the idea that there was something structurally misaligned or some weakness that was causing this pain. And if the idea is that there's something wrong structurally in the body, but the pain's neuroplastic, it's not going to be everything someone hopes it's going to be.
Exactly. So I'm curious if you can talk a little bit more about Ishwish for me.
Yes.
Your work there, what it's been like, and what you do.
So ISWISH is the International Society for the Study of Women's Sexual Health. It's a prominent organization in the field of sexual medicine, which includes the management and treatment and diagnosis of pelvic pain. So a lot of doctors who really care about this work are in this organization. And I have been on a few committees, and we also work very closely with the forum that I started. I did get the research grant from them, and I feel like they are very supportive of wanting to really understand and validate patients' experiences. ISWISH works closely with different patient advocacy groups, for example, the pelvic pain nonprofit Tight Lipped. And I think when I had the event for ATNS, the SIG on May 1st, a lot of people from ISWISH came. So the topic of that event was pelvic pain is not in your head, the science of neuroplastic pain. And some people from the board that I invited were very excited to learn more. I think the doctors at ISWISH know that that sexual medicine is also a relatively new field, about 20, 30 years, and that there's a lot that we can continue to do to help patients.
Yeah, that's fantastic that they're learning more and more about neuroplasticity. And the really great thing is if we can combine both worlds, the outcomes can be,
Yes, definitely. And then two of the doctors at ISWISH who do a lot with neuroscience came to this event and wanted to speak about it more with me, which I really, really appreciated.
Yeah, that's fantastic. Your work is going to help so many people. And, for me, I needed to hear it from a doctor that my symptoms were neuroplastic. I had two therapists that basically told me that my symptoms were neuroplastic, and I wouldn't go to the other side, let's say, of just completely mind-body symptoms until I heard it from a doctor. So I find it so great that you have a medical background and you've struggled with chronic pelvic pain in the past, and you've come to the other side. Because, as much as I want people to take my word for it to a certain degree, I'm trained by Dr. Schubner and I go through his complete criteria, I will send people to a doctor so that they can hear it from them to get that diagnosis, because it's helpful. It was helpful for me, so I encourage people, hear it from a doctor who has a medical background. So would you find that that was the case for you at all? Like that, hearing it, did you need to hear it from an MD?
Not necessarily. I mean, the family member who initially brought the idea up to me didn't use the idea or the language of neuroplastic pain exactly, but it was really through like my own reading about it. It was never a doctor who I saw who introduced that idea or really talked about that idea with me. It was interesting that with two physical therapists I saw they did bring up like the concept of central sensitization, which is a very similar topic, but it was never really explained in any more detail to me, and so I didn't think twice about it. But I think I was in a position of privilege with my own medical background to also be able to learn about this and kind of look at data for myself and see what I thought.
So I tell my clients that my life is completely different now. Not just because I don't have chronic pelvic pain anymore, but I have learned so much about myself, my body, the brain, and I believe it's made me like, a better person, more open and understanding. I obviously have a much more regulated nervous system through all the somatic tools that I use, and I still use them today to help me in life. So I'm just curious, do you feel like that your life has been changed from all this knowledge and what you learned?
Yes, absolutely. And that feels amazing to be able to say, for sure. I also feel like I am someone who's much more open and curious, someone who knows that there are things that I don't even know I don't know, which is different than just not knowing things.
Right, yeah.
In just things that I really enjoy, I really just like lean into those a lot more and like really savor them. Or just, I just got back from a bike trip in France, and to be able to do that when I was having knee or pelvic pain would not have seemed possible as well. And I think it's also now and in the future going to help me connect more with patients and help people, and that's going to be really rewarding too. So it's amazing that I've come to a place of acceptance of these symptoms, because it also was a process, and at one point felt like that would be something very, very far away.
I know that I am so much more present in my life than I was before. And I would run around just, okay, I have to do the laundry. I have to take the kids here. I have to take the kids there. And my life now, I notice the birds and I notice the flowers and I listen more. So not that I ever wanted to have chronic pain. And for those people listening out there, I don't want people to be in pain, but there was a purpose far beyond me doing what I do in my career now. It's just made me more present and more in tune to what really is important in life.
Yes,
which is nice.
More present and more in tune to what matters to me. I completely agree with that.
Yeah. So I'm kind of curious if you could just talk about, you're an MD. What way would you like clinicians to be trained to work with neuroplastic pain and especially pelvic pain? What would you like to see happen?
There's a lot of things. I think, I think one would be especially for doctors or clinicians who really focus on gynecology, urology, internal medicine, or family medicine, to know what would be the broad number of things to consider for someone with pelvic pain and how to work that up, and then also to keep neuroplastic symptoms on that list, and then to know what to do next. I don't think everyone has to know about pain, how to treat patients with pain reprocessing therapy or somatic tracking, but to know then who are coaches that doctors can refer patients to, and to know that we're in a team and everyone has their own area that we need each other for helping patients. I think in general, for chronic pain, there really is not a lot of dialogue on neuroplasticity. The models of pain that are currently being used, I think, are not the full picture, but doctors know and can see when there's a mind-body component, but then what next is really the question. Just getting this information out there more is so important. And then I also would want patients, people in general, to know more about this, because it's also their part, if they do have neuroplastic symptoms, to know about this. And if people, it's such a paradigm shift to be thinking about this, but if people can know that it's out there initially, I think that would be really helpful in kind of bridging the current paradigm and then the understanding of neuroplastic symptoms.
You know, we are lucky to a certain degree that in 2025 we can Google something. And I think I Googled pain-free and things just started coming up. And I found Dan Buglio's videos, which I think are fantastic. I also found Dr. Schubner's book. So we're very lucky that we have resources. But when I first got my symptoms in 2015, 10 years ago, there wasn't as much out there. Mm-hmm. And now we can just go on Google and type in pelvic pain success stories, and things will come up so that we can learn more about it. And one of the things I do personally is I try to go on podcasts just for the sake of sharing my story so people know that they can get better, because there was those few stories that I found out there that I was like, oh my God, there's someone's story with pelvic pain and they got better. And it was like just grasping onto it for dear life, you know, that there was hope for me to get better. So, you know, the more we can spread the word about neuroplasticity, you know, the better.
Yes. And how I first found out about your work a few years ago was because of your Dan Buglio YouTube video that one of my mentors, who's a doctor who knew what I had been going through, sent to me. And so I watched it and then went on your website and then reached out.
Right. Yeah. And, you know, there's so many ways to help yourself from chronic pain, and there's so many different coaches out there, but it's about just, you know, and they're all great. It's about just finding the one that resonates with you and finding the tools that really make you feel good. And for me, it was somatic experiencing, and that's why I went and got certified through traumahealing.org, and it's Peter Levine's his mission with somatic experiencing. And breathwork was a big thing for me, but that doesn't mean it's, you know, that's the key for somebody else. So for those people that are listening, what would you say to them if someone's feeling dismissed, afraid, or even unsure that they can heal right now?
I think for people with neuroplastic symptoms who are open to the stuff we are talking about, there is so much hope. These processes that we're talking about really do work. They just take time. And to know that there are clinicians who really do care and listen, and they could go on the ISWISH website or the ATNS website and find the list of those practitioners. I would also say that if they're in their 20s and 30s and want to reach out to the early career SIG at ATNS, our email is earlycareer@symptomatic.
So they can find you there.
Yes.
So this has been great. So, I mean, I can't be prouder. I am so happy that I was able to be, you know, a part of your journey, and that hopefully the parts of fun will still resonate with, you know, you and me forever, because that's what life's all about, looking for fun and joy. And it was, you know, such a pleasure to have you on the podcast today. And I really appreciate you being here to share your story, because your work is going to help so many people. And I can't wait to be a witness to what happens in your future.
Thank you so much. Yes, it was so nice to reconnect over the podcast. And I've been listening. I am a fan myself. So thank you so much.
Thank you so much for tuning in to Beyond the Pelvis. If today's episode resonated with you, I invite you to join us inside the Pelvic Healing Circle, a supportive space for deeper healing, connection, and transformation. And if you enjoyed the show, it would mean the world if you took a moment to leave a review on Apple Podcasts. Your words help others find this podcast and remind them that healing is possible. Until next time, stay connected to your body, trust your inner wisdom, and keep going beyond the pelvis.